podcasts on unctv.org are made possible through the financial contributions of viewers like you, who invite you to join them in supporting UNCTV.
Help for people with HIV/AIDS is also coming in the form of rapid scientific advances, new frontiers of medicine for a new age of the disease. And it starts with testing. AIDS advocates say no matter who you are, it's important to be tested for HIV because early detection improves your chance of survival and reduces your risk of transmitting HIV to other people. Now, North Carolina is the first and only state in the country to test for the newest, most contagious cases. More than 100,000 blood samples pass through this state-run lab each year. They come from all across North Carolina to be tested for HIV. But before the test being done in this machine was available, some people with the earliest stages of the infection might not have gotten the right results.
Our traditional ways of detecting HIV were dependent on an antibody response. So this is a period that we could miss because of that.
The period is called acute HIV, a 4 to 8 week window when someone is infected, but the immune system has not begun attacking the virus with antibodies. That makes it impossible to detect with a standard antibody test and much easier to transmit.
As a result, it is the most infectious period of HIV, period. It's a very short window of time we're talking about, yet some estimates put as much as 40 to 50% of transmissions occur during this acute period.
That's why in November 2002, the state began testing for acute HIV. Any blood sample that tests negative with the standard antibody test also gets the acute test, which looks for the virus itself. The program costs about $400,000 a year, just a few dollars per test.
When you start thinking about, is it worth the extra $2 or $3 per test to identify people that could be missed for years, I think the overwhelming answer to that is yes.
When technicians in this lab discover a case of acute HIV, another team of people goes to work, the disease intervention specialists. Manager Todd Van Oy says they are the first responders when someone is diagnosed.
Disease intervention specialist is basically a counselor and an investigator at the same time. The investigation side, we follow up on any reports of positive STDs. Basically now it's HIV and syphilis. And we follow up with the individual, refer them into care, offer counseling services to them.
Guilford County outreach worker Lloyd Mickens is sometimes the one who breaks the news.
It's not a fun day. Not a fun day at all, unless a lot of them have the idea that they are positive, and some of them do take it fairly well. But then you have others who it's really sad. You kind of sit and cry with them.
As hard as the job is, Todd Van Hoy says it's critical for people like Lloyd Mickens and Wake County disease investigator Alice Stanford to do it quickly, in part so the infected person will not unknowingly infect anyone else. Specialists also talk with the patient about their sexual partners. North Carolina law says those partners must be told they've been exposed to HIV.
If we can get to a person's partner quick enough, we can possibly give them medicine and prevent them from ever getting the infection or developing it.
Dr. Peter Leone says the program has identified more than 100 people with acute HIV and possibly prevented hundreds more from being infected, including an unborn baby whose mother tested positive.
Identifying her, getting on therapy, and preventing transmission saved probably, never mind the fact that the baby benefited, the cost of that one child would have been about $250,000 over the course of that kid's lifetime. So we prevented transmission and we saved the state money.